so tests need to be done. So what tests do you do?
So, I mean, first, before getting the test, we have to review the maternal history. So we look at the risk factors for infection from the mom. Did she have group B strep? Was there any leak in the amniotic fluid for a prolonged period of time, which we call prolonged rupture of membranes? What kind of symptoms the baby has, and how long has it been going on for? And then we do a comprehensive physical exam, and based on those, we start doing the diagnostic tests.
Okay.
So I can go ahead and...
Yes, we're going to actually look at some of these exams and tests, specifically starting with blood culture. So blood tests from the beginning.
Okay, so the blood culture is the gold standard for diagnosing sepsis. So for establishing the diagnosis of sepsis, you have to have a positive blood culture. So you're going to be isolating an organism from the blood. Most of the times it's a bacteria. Sometimes we also have other causes of neonatal sepsis would be less likely would be viruses or fungal infections. But usually we send for a bacterial blood culture.
Okay.
Now, the sensitivity of the blood culture is only 90%. So in some cases, we're not able to isolate an organism from the blood culture.
Okay.
But if we have a high index of suspicion for sepsis, given the baby's symptoms and other labs, sometimes we do treat babies for sepsis even if we don't get a positive blood culture, because, as I mentioned, the sensitivity is only 90%. And remember, with these kids, when we get those blood cultures, we're only getting 1 cc at a time. In adults, we get a bigger volume. We can't get so much blood from the babies because they're small, their blood volume is smaller. So that causes us to not get positive cultures. And the other thing is sometimes these mothers, the mothers of those babies, are exposed to antibiotics. They receive antibiotics. So that could make the blood culture sterile, so it might not grow bacteria.